Welcome to Anatomy DAHAR series. Today's topic is development of the mandible. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. Author's note. Anatomy is a subject about structures of different parts of the body, their locations in relation to one another, and their possible bodily functions. Therefore, it is the basic and foundation subject in medicine. Considering the number of structures making up different parts of the body, anatomy is essentially composed of many names and facts. The problem is how to remember them. One way is by reading the text repeatedly, another by using mnemonics, and some follow other means such as discussions, etc. Personally, I believe in the saying, a picture is worth 1,000 words. Anatomy is considered as being composed of structures that can be readily visualized, and the subject can be learned through appropriate diagrams. In fact, learning anatomy without diagrams would be like sailing through uncharted waters without a compass. Learning anatomy from simple, clear, and well-illustrated diagrams may be considered the best way to learn and remember the subject. Studying such diagrams carefully would clearly reveal the locations and relations of the structures in the body and facilitate learning and remembering. Hence, I would like to suggest and advise the readers of Anatomy DAHAR series to try and learn anatomy through the diagrams, as I have provided good enough for diagrams in each topic. Thank you. Abdul Hamid, Abdul Rashid. Basic embryology. The first pharyngeal arch consists of two portions, the dorsal portion, the maxillary process, and the ventral portion, the mandibular process. This is right lateral view of the embryo. This is first pharyngeal arch. This is the dorsal portions, maxillary process, and this is ventral portions, the mandibular process. Mesoderm is the middle of the three embryonic layers. Mesenchyme is the embryonic connective tissue in the mesoderm. In a further development of the mesenchyme of the first arch, some of the components ossify to become bones, some form muscle tissues, and others become ligamentous or disappear. This is the right lateral view of the embryo. This is maxillary process and this is mandibular process. The maxillary process, the mesenchyme of the maxillary process gives rise to premaxillar, maxillar, zygomatic bone and part of the temporal bone through membranous ossification. Premaxillar, maxillar, zygomatic bone and part of the temporal bone formed through membranous ossification. All are bones of the upper jaw. The mandibular process, this is the one which is more important. The mandibular process contains number 1, Meckel's cartilage, which is wrapped around by the covering, that is perichondral membrane of the cartilage, and they are surrounded by number 3, mesenchyme, that is the connective tissue of the mesoderm of the mandibular process. Mandibular process of the first arch. This is right lateral view of the embryo. This is mandibular process of the first arch. This is the second arch. During further development of the mandibular process, Meckel's cartilage disappears, except for its dorsal end that forms two ossicles of the middle ear, malleus and incus. The perichondral around the Meckel's cartilage becomes ligamentous, that is sphenomandibular ligament. So from where does the mandible develop? The mandible does not develop from the Meckel's cartilage because it has been disappeared. The mandible is developed from the mesenchymal tissue surrounding the Meckel's cartilage by both intramembranous and endochondral ossifications. Development of the mandible continuation. This is right lateral view of the mandible. This is symphysis menti. This is body of the mandible, and this is ramus of the mandible, and this is two upward projections. This is coronoid process and condyloid process. This is mental foramen. You can see from the external surface of the body of the mandible. This is mandibular foramen on the internal surface of the ramus of the mandible. The part between the mandibular foramen and mental foramen is developed by membranous ossification, A. The part medial to the mental foramen, this is the one, medial to the mental foramen, is developed by endochondral ossification, area B. Coronoid and condyloid processes ossify from secondary cartilages, C, not related to the Meckel's cartilage. Each half of the mandible ossifies from only one center, which appears during the 7th week of intrauterine life. It is the second earliest bone to ossify in the body, clavicle being the first. The other centers appear during the 10th week of intrauterine life. At birth, the mandible consists of two halves connected at the symphysis menti by cartilaginous nodules. During the first year of age, the bony union at the symphysis menti starts from below upwards and is completed at the end of 3rd year. Features of the mandible in different age group. Look at the diagrams. That is the right lateral view of the mandible at birth, children, in adult, and in old age. What are the features? Let's talk about it. Angle of the mandible. In children, it is about 140 degrees. In adult, it is about 110 degrees. And in old age, it is about 140 degrees. Mental foramen, MF. In children, it is nearer to the lower border. In adult, midway between the two borders, that is between the upper and lower border. And in old age, it is nearer to the upper border, you can see here. Next is mandibular canal. In children, it runs near the lower border. In adult, runs parallel with the mylohyoid line. And in old age, it runs nearer the upper border. Condylar and coronoid processes. In children, coronoid process is higher. In adult, condylar process is higher, and in old age, coronoid process is higher. Please see the explanation in next slide. Explanation of the features of the mandible in different age groups. In children and in old age, there is no teeth between the upper and lower jaws. In children, the teeth are not erupted yet, still inside the alveolar parts, and in old age, however, they have already fell off. Therefore, the upper and the lower jaws are touching with absence of the wide gap between them. The ramus and the body of the mandible are more or less along the same plane, and thus the angle is wide, about 140 degrees in children and in old age groups. But in adult, the teeth are present and the gap between the two jaws widen. However, head of the condyloid process remained at the same place at the temporomandibular joint. The ramus becomes more upright. The angle between the ramus and the body becomes narrow, about 110 degrees. In children, the teeth are still inside the alveolar of the body. The mental foramen and the mandibular canal are therefore away from the upper margins of the alveolar and nearer to the lower border of the body. However, in old age, the teeth are fell off. The alveolar part of the body is absorbed. The mental foramen is nearer to the upper border. In children and in old age, as the angle between the ramus and body widen, the ramus inclined, leaned backwards, together with the condyloid process. The head of the condyloid process becomes at the lower level than that of the apex of the coronoid process. Clinical correlations of the mandible. We have two diagrams here, diagram A and diagram B. Diagram A is showing sites of common fracture and their percentages. The mandible is commonly fractured at 3 sites that are weak following violent injuries. They are number 1, neck of the mandible, because it is constricted and narrow, 35%. The angle of the mandible, because of abrupt change in direction and force, 45%. The canine region of the body, because the root of the canine teeth is prolonged and reduce the bony mass. It may lead to malalignment. Here is 15%. When the mandible is fractured, let's take the commonest site, the angle of the mandible. Mandible bone will be divided into 2 at the fracture site, proximal part and distal part. What will happen? The proximal part will be pulled up by temporalis muscles, which is attached here, and the distal part and the chin will be pulled down by glenohumerus, digastric and hyoglossus muscles. Now let's talk about diagram A here. The area just lateral to the chin. In diagram A, just lateral to the chin. It is the site of the world's only 8-weight categories boxing champion, pound for pound, Manny Pacquiao's favorite knockout spot. And illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.